Record on my side. So, hi everybody. Welcome to my talk tonight. It's called Trailblazing Your Career in Alternative Health. I will basically be talking about choosing a career path in the alternative health field because there are so many of them. It can be a bit overwhelming, and so I want to talk about that, and I want to talk about why people in these fields are so sorely needed. And you may think that it's a niche thing, or it's, maybe they need you here or there, but it's like when we quantify how big the problem is and how bad the healthcare system is, it's pretty apparent that more people in this are urgently needed. So I put my email down in the comments, and I'll put it down at the end. We'll save questions till the end tonight, but I am totally here to answer any and all questions just for the sake of flow of the presentation. We'll just do it at the end. And then if you have more questions, you want to follow up with me more, Stephanie can give you my contact info. I definitely want to encourage y'all and anybody who's interested in this kind of thing. I want to be able to help you take the steps to do this kind of thing if you feel that you're interested and you're ready. So a little bit about me. I am a doctor of chiropractic. Stephanie and I were talking. My practice is in Central Phoenix at 26th Street Indian School. So I do that. I've been doing it for about 3 years. And so this is actually career number 2 for me. Originally, I worked as an engineer in the microchip industry. I had absolutely no interest in anything alternative healthcare or really anything mainstream healthcare either. I was just a guy working at a microchip company. And honestly, back then, I thought that anything alternative, like acupuncture or chiropractors, were all just quacks and people who couldn't get into medical school, so they did other weird stuff that was obviously unscientific. But I really had no idea, nothing I'd experienced firsthand or knew anybody who did or anything like that. So, but I got sick, and I got really sick. Came in my late 20s. I came down with chronic fatigue, chronic muscle pain, eczema over my hands, really bad digestive problems, brain fog, and I think I mentioned chronic fatigue. And this all sort of spiraled over the course of a few months in the beginning of 2010. So about 10 years ago is when I got sick. And so thinking I was doing the right thing, putting my faith in the medical system, went to my medical doctor. They examined me, looked me over, said, everything checks out. We'll do your blood work. Blood work comes back, nothing out of the ordinary, right? So get sent on to the specialist for my skin condition, the dermatologist, get sent on to the specialist for my digestive problems, the gastroenterologist. And I'm just getting the runaround, getting no answers. Everyone's telling me, oh, your blood work looks normal, like everything looks normal. You're fine, nothing to worry about. And I wasn't fine. I was not doing well. I was very sick, and I was trying to go to the doctor to get help. And basically, they couldn't diagnose me. They had really no treatment. And everybody pretty much just kind of shrugged their shoulders. No one really cared. No one said, hey, you know what, Ben? We haven't been able to figure out what's wrong, but we're going to find the person who can. No, it's just pass you off to the next guy and, bill your insurance and, then have the next person walk in the door. It wasn't that anybody was intentionally, being cruel. They just didn't care because they weren't paid to. And the system, basically incentivized them to just churn through as many people as possible. And there was no gain for them to take anybody under their wing and really try to figure out their problem. So I ended up being tasked to do that myself. And so that was when I essentially just went on self-experimentation and self-education spree, just trying to learn as much as I could, figure out something to fix this, because no doctor can, and there's got to be a way. I was really not willing to just lay down and die. I don't know why. My health was really getting bad. I could have just rolled over and just let things got worse, and who knows. But I wasn't, for whatever reason, I was a fighter, and I was not going to let that happen. So eventually figured out some dietary changes that really improved my condition. And as I got more, rigorous about them and, you know, strict with my diet and figuring out what foods I could eat and what foods I couldn't, I saw just like total change in everything. You know, eczema went away. Muscle pain was probably the first thing to go. Energy levels went through the roof. Like I went from being chronically fatigued to not just having normal energy levels, but feeling like way more energy than I used to. I was like, man, I have my whole 20s, I haven't felt this good. I feel like I'm 8 years old with my energy levels again. What happened? So digestion got a lot better. So not only did I recover, but I came out the back end healthier than what I remembered I could be. So it was a real eye opener to me. And that nutrition could play such a role in health. And like I had been one of those people who stays up late all the time, and I caught up on a lot of sleep debt. I started meditating, all these other things that really started to feel the benefits firsthand and really changed my whole perspective on everything. Really became a person who lost a lot of faith in mainstream medicine, and whose eyes were opened up to just how powerful stuff in the alternative fields are. And I really hate the word alternative, but that's what everybody kind of knows it by. And we'll talk about some other nomenclature in this talk that I think is more appropriate. So let's see. Let's go into it. So I think that explained me enough. How do I share? Okay. So what we'll cover tonight, like I talked about, the present medical care system, what's working there, what isn't working, what do people need, like what are the gaps that they can't fulfill, and then how can you fit in? Anybody who's willing to you know, fill in these gaps, how can you do it? Where are you needed? What's the best route to do it? And there's no best one route. We'll talk about a lot of different things and sort of give you some guidance on choosing your own path. Because in medicine, it's pretty specific. Like you practice this way, you do it this way, and if not, you're out. And it's sort of a double-edged sword in the alternative health field that there's a spectrum of how people practice, and there's no necessarily one right way. And it's good. And we have a lot of diversity, and not everything is for everyone. And we're still figuring a lot of things out, but we're much more open to new ideas. So you can type this in the chat box. How many of you have heard of the term a sick care system, right? That we don't have a healthcare system, we have a sick care system. And just nod your head. So yes, absolutely. We treat disease. We do not try to build health. We take care of people when they're already kind of in a pretty bad way. And so this is a headline from 2 years ago, and it says U.S. health spending twice that, 2x that of other countries with worse results. So not only are we more expensive, much more expensive, but we're much worse. This is like if there were another university out there, let's say that they were in another major city in Arizona, Tucson, for example, and they said, we are the 33rd best university in the country. We're also the most expensive. Come get your degree here. Like, who would do that? That's like you're going to be the most expensive and you're only the 33rd best? Like, if I'm talking value for my money, that's a ripoff. Like, no one would go to that school. But in the U.S., we're basically saying our healthcare is 33rd best in the world and we're twice as expensive as everybody else. Like, you would never get healthcare. Like, if people knew this, they'd just be driving to Mexico every time they needed, you know, to do anything, right? So it's a disaster, straight up. Like, it has gotten so expensive, and all the political discussion around it, no matter what your views may be, and this is not trying to pick any political side, is basically around like who will pay for this very expensive healthcare bill. Like, are we going to do single payer? Are we going to do Medicare for all? Are we going to do a hybrid system, or private insurance, public insurance, Medicaid, like all these things? But nobody is asking, why is it so expensive in the first place? Because if we got the price down, it wouldn't be unaffordable anymore, and we wouldn't have to constantly be trying to figure out new ways to foot the bill. Like it would just be affordable. And the sad fact is that the way we're doing it, it's just not affordable because it's not working. It's not getting results. So you keep throwing more money at it and getting nowhere. So we'll talk about that. So we have a medical system that's extremely good with treating what's called acute conditions. Okay, so if you fall and break your arm, if you get a cough or a cold, if you get in a car accident and your arm gets ripped off, they can sew that back on. They can treat the cough. They can treat the cold. You get COVID-19, they can put you on a ventilator. Okay, they have ways of treating acute diseases where you get sick for a period of time and then you hopefully get better. So any kind of infectious disease is going to be an acute condition. Any kind of like you break your arm, they put you in a cast. Like they got that locked down. What they are terrible at is treating what's called chronic conditions. Okay, and 100 years ago, 200 years ago, the things that killed most people and caused the most problem were acute conditions. But now we live in a new age, an age of chronic disease, where we have things like diabetes, heart disease, cancer. Okay, these are the things that are killing people now that 100, 200 years ago was barely a blip on the radar. Like in the 1800s, does anybody know what the most common cause of death was in the United States? Anybody want to guess? Diarrhea. #1 cause of death. Okay? It's funny, but it's true. All right? And so here's the problem. Most of these chronic health conditions are caused by diet and lifestyle. But the medical system is still trying to treat them with drugs and surgery, with its current tool set that it used for treating diarrhea and broken arms and coughs and colds, okay? And doesn't really work that well, right? Because we're focusing on the symptoms instead of the root cause. So a lot of this chronic disease epidemic is fueled by the food system. The food that people are putting in their mouths every day is fueling heart disease, cancer, diabetes, so many of these conditions, all right? And we'll talk a little bit more about this here soon. And so the prevailing medical model is to treat things one of two ways, okay? And I hope this is my internet connection's unstable. If it's somebody say something in the chat if you can't hear me. So we have drugs, okay? So you got a cough, you will suppress it with a drug. Your blood pressure is too high, we'll bring the number down with the drug. You have an upset stomach because you ate like chili cheese fries, you take a drug, okay, to try to just basically mask the effect. And then if things get really dire and the drugs just aren't cutting the mustard, we have option #2, which is surgery, okay? And if any of y'all are old enough to remember or saw the rehash on Netflix, Uncle Joey from Full House, whose tagline was, "Cut it out," right? You just have the scissors, cut it out. And that's basically the approach. Like your appendix is not working, cut it out, okay? Gallbladder's having problems, cut it out. Intestine, you have colitis or Crohn's disease and it's giving you problems, cut it out, just, well, there's one problem, like you kind of need your organs. Like it's a great, last ditch effort. Like I'm glad surgery exists. Like if, I fall and get run over by a car, my arm gets ripped off, I'm not going to just like rub essential oils on it. Like I'm going to go get the surgery, get the arm reattached, There's a time and place for it, but your vital organs and glands are things you generally want to try to keep. So the fundamental fatal flaw with the current healthcare system is that we are trying to medicate our way out of problems we behaved our way into. Okay, so if you take down, like maybe you're taking notes tonight and you're like, everything he says, I'm going to write it down, or I'm going to screenshot the important parts. Like if you only write down one note or screenshot one part of this whole talk, right here, okay, this. We're trying to medicate our way out of problems we behaved our way into. And it doesn't work, all right? And then we have a subset of problems that we've medicated our way into, all right, with this opioid epidemic, where we're putting people on these painkiller drugs, and then they're getting addicted, and then more and more drugs, and they have an overdose. And even if we cut them off from their prescription drugs, they go find it on the street, and then it's totally unregulated. And that's a whole nother can of worms. But basically, we're trying to medicate our way out of problems we've behaved our way into. And sometimes we are medicating our way into problems. But the best way to get out of these problems, whether we medicated our way in or we behaved our way in, is to behave our way out. So I want to look at leading causes of death. Like, what are people really dying from? And even if we put the COVID-19 numbers in here, they don't hold a candle to most of these, okay? It's hundreds of thousands of people a year, and this is in the United States, okay? So number one cause of death, heart disease. Number two cause of death, very close in number, in fact, approaching, I can't know what year these are from, but it's within the last 5 years. Cancer is now killing more people in certain states than heart disease. Like, it's number two, but it's quickly vying to get number one, cancer, okay? Lower respiratory diseases. This is basically smoking-related illnesses, okay? And you'll notice that some of these are bolded, okay? And this basically means that they are preventable and or reversible with diet and lifestyle. So heart disease, they'll treat it with giving you blood pressure medications, giving you statins for your cholesterol, doing bypass surgeries, but they haven't yet invented a drug that slaps the cheeseburger out of your hand, okay? So we can do all these things with the drugs and the surgery. People live a little longer, but we can actually completely reverse many cases of heart disease with diet and lifestyle. Like, literally, the body cleans out its own arteries when you finally stop clogging it up with bacon cheeseburger, believe it or not. Cancer, many people think that cancer is just you lost a bet and you got unlucky and you got cancer. Data is pretty clear, 90% of cancer, diet and lifestyle related. And a lot of them can actually be reversed or improved with changes in diet and lifestyle, if it's caught early enough. Lower respiratory infections, obviously caused by smoking. You can quit smoking, your chances of survival increase dramatically. Accidents, okay, so this is car accidents, this is on the job accidents, this is just sometimes bad stuff happens and people die, and that's that we can't account for that. We do know that this also includes medical errors, so people who are given the wrong drug by accident in a pharmacy, people who given the right drug in the right dose and still get killed by accident by their drug, because that happens. And then drug overdose deaths, like we talked about with the opioids. That number continues to skyrocket through the roof. And a lot of these people are people who overdosed on street drugs, but started out on prescription drugs that were addictive, and they got cut off. And it's quite tragic how much that happens. Like, a lot of these people who end up junkies, per se, are just normal people who got a prescription for pain medication that they got to do. Stroke, another cardiovascular one. That is caused by diet and lifestyle, okay? Again, a lot of people I've seen it happen. I've seen it happen where literally I was working at a clinic where we did diet and lifestyle interventions. A woman walked in on a walker, having just had a stroke earlier that day, and we put her on a healthy plant-based diet, and within a week, she was off the walker, okay? So it can be done. Diabetes, completely a disease of foodborne illness. Okay, completely caused by diet and lifestyle, like purely. And this one is an expensive one, because when people get diabetes, it's not just the blood sugar problem. So they start losing their vision, they start losing their toes, they start having neuropathies and skin conditions and heart conditions, and it just kind of explodes into this big thing where they get really, really sick, and it's really expensive to take care of them. Influenza and pneumonia, okay. That one's not much you can do about it. You stay healthy, you can avoid those things, but not much. That one's not really reversible or preventable with diet and lifestyle as much as the other ones are. Kidney disease, definitely preventable with diet and lifestyle, not so much reversible. Suicide, it happens, okay? That's another cause of death. And then you go down the line, and a lot of these are preventable and reversible with diet and lifestyle. And I don't want to belabor the point too much, but you basically see that all these ones in bold, the medical system's trying to treat them with drugs and surgery. We can make them disappear with diet and lifestyle interventions, okay? So we have a tool set that is more powerful than any drug or surgery you can name, but it's not out there, okay? Because people haven't been vocal enough yet. And these pharmaceutical companies make a lot of money. And their advertising dollars are the main thing keeping the mainstream news channels afloat. Like, they pay the most money for ads on TV. So they kind of get to say about what gets talked about in the news and what doesn't. All right, so what is the alternative? Okay, it's like, you know, we basically talked about the medical model, which is drugs and surgery. And here's where a lot of people trip up, okay? Because they get sucked into a way of thinking that's called the alternative medical model. And this is actually a misnomer, okay? This is something I want you to be aware of. There's nothing wrong with it per se, but I don't think it's the most effective way to do things. So the medical model basically states that, you know, when you have a disease, when you have some sort of problem, it requires drugs or surgery to fix it, okay? So, and so the alternative medical model basically says, it also tries to fix disease. It says you have a disease, okay, well, we're not going to use drugs because they're pretty harsh and they have side effects a lot of the time. And we're going to try to avoid surgeries because those are dangerous too. We're going to use an herb or an essential oil or you know, some sort of botanical extract to treat this. And so both of these are essentially what's called quid pro quo models. That there's a certain disease and there's a certain cure for said disease. All right, and so neither is looking at the root cause. They're both basically looking at symptoms and how do we suppress the symptoms or treat the symptoms of the disease. All right. So, you know, you're depressed, just take some St. John's worts. It's a lot better than Prozac, okay? So then we have what's called the health model. This is a completely different model, all right? And this is what I subscribe to, and if you haven't considered it, I want you to consider it. So the medical and alternative medical model basically subscribe to the idea that, like, what you do when you're sick to get well is different than what you do to get well once you're already sick. So, for example, they'll tell people, get your kids to drink milk. They'll give them strong bones. It'll make them strong. But if your kid's sick, don't give them milk because it'll make them stuffy and it'll be harder for them to recover from the cold. Okay? So somehow the milk knows if you're sick or if you're well. And it'll make you well. It'll make you sick if you're So it'll make you well if you're sick, but it'll make you sick if you're already well. Or if you're sick, it'll make you worse. Butcher that. Okay, it'll make you more well if you're already well, but if you're already sick, it'll make you more sick somehow. Okay. Then they say, okay, if you're sick, you need to take drugs. But if you're well, don't take drugs. There's a war on drugs, and we're trying to stop drugs. All right, so somehow the drugs know that if you're well, they'll make you sick. But if you're sick, they'll make you well, like somehow. So the health model basically says that if you eat healthy, you exercise, you meditate, you get enough sleep, you manage your emotional state, you can stay well. And if you have some sort of disease or malady, you can recover from that using these methods, okay? So we have what's called congruency, that like the things to do when you're well to stay well are the same things to do when you're sick to get well. And this is what actually reverses these chronic conditions. Because if you just try to take blueberries as a supplement when you have high blood pressure and you're still knocking back cheeseburgers and like working a high stress job and not sleeping enough, like you're still gonna have heart disease even if you eat, you know, a few more fistfuls of blueberries. Like you gotta overhaul your lifestyle to really get the effects. And I feel like I got my soapbox there, so thank you guys. So what I want to ask you now is, what are you passionate about? If you're like, okay, well, how do I approach this? What career path do I choose? It really comes down to what are you passionate about? Like what lights you up? And so I'm going to go through a bunch of these, but most of the time people come to this because they're passionate about it in some way, that it's affected their life in some positive way. They're not just like, ooh, acupuncture, I always liked sticking people with needles, like that would be fun. No, it's probably because they had an experience with themselves or a family member or someone close to them saw them gain health benefits, saw them recover from some condition using one of these modalities, and they became passionate about it and they wanted to spread the word. Nobody's really doing it just for the money. Like if you're like, oh, I could, become a chiropractor and do an insurance billing scheme and make lots of money. Get out of here. Like there's other ways to make a quick buck. Okay, not that there's anything wrong with making money. Like go do this and serve a lot of people and help a lot of people, change the world and make a lot of money. Do it. Awesome. Okay, but if you're not passionate about it, if it's not something that lights you up and you really want to serve and help people, you're not going to last. You're not. It's because it's hard work. It's really hard work, but it's great work. It's fun work. So hope is, and it's okay to be multi-passionate. If you're like, wow, I really love like this and I love this and I don't know how to combine them, that's okay. And so my last charge to you is start learning now. Like if this stuff is interesting, start reading up on it. Start reading books. Start reading articles. Start listening to audios, watching videos. You can get started learning about it in school without having to go through a credentialed program. Like just feed the beast, because it's important to be a lifelong learner. If you're like, okay, I'm still finishing up this degree or this undergrad or grad or whatever at ASU, you can still start learning this stuff now. And I guess you guys just finished up finals, so you got some time on your hands, and you're done learning all the stuff you had to learn. And now's your chance to just like dig into the stuff you're excited about and like want to learn. And then there you go. So we'll talk about some of the different groups, and I tried to go through as many of them as possible that I was knowledgeable about. And so if there's anything somebody is excited about that I left out, I'm sorry. You can ask me a question at the end. I really want to cover everything and sort of like what are the strengths and weaknesses of each one. And this is not an endorsement of any particular profession. So we'll just go through the list here. So obviously you can be a medical doctor who does alternative stuff, who is knowledgeable about the health model, is knowledgeable about all these other modalities. And there's advantages to that because you learn all the medical stuff. Like you go to medical school and you're going to learn a heck of a lot. Okay, you got an extensive education. But medical doctors are not taught about nutrition and lifestyle medicine stuff in school. You're going to have to learn all that on your own. Okay, not that you shouldn't go learn that on your own no matter what you do, but you're not going to get any of it in school. And you're going to get a lot of time learning drugs and surgery, which probably aren't interesting to you. And it's going to be a bit of a hassle to have to learn all that stuff if you're not passionate about it, or if you're, through your viewpoints, pretty opposed to it. Not that, like I said, there's emergency situations where it's warranted, but, if it's going to be a drag, it's going to be hard to finish something like this. So I would say, do it if you're interested, but realize that it's going to be a lot of work, and some of it's probably going to be work that you're really going to not like. But some of you may like it. And so, like I said, the excellent scope of practice. You can pretty much do whatever you want. You can write your own ticket. Okay. Tools to help with chronic disease are learned outside the classroom, like I talked about. But everybody should be learned outside the classroom. Okay. Naturopathic medicine, naturopathy. So this profession is pretty awesome. All right. I actually considered doing it, but at the time I lived in Texas where it wasn't licensed, and I figured if I want to practice in Texas, this is probably a bad idea. But also a 4-year degree, typically 15 quarters or 10 semesters done back to back with not with summers off, right? So education is very similar to medical school. You learn the physiology, the pathology, the biology, biochemistry. You learn pharmacology, drugs. You learn minor surgery. You don't learn major surgery. You also learn a bunch of stuff that they don't teach in medical school. Okay, you learn botanical medicine. You learn nutrition. You learn, most of these schools are teaching acupuncture. Okay, you're learning how to adjust like a chiropractor. Maybe not as you don't get as much education on as a chiropractor does, but you get enough to make some moves. Okay, and so you get a very wide scope of things you learn, and you're probably not going to end up doing it all, but you can focus on what you want to focus on. And so the scope is going to vary by state, and only about half the states-ish you can actually be a licensed naturopathic doctor. Last time I checked, it was 25 states out of 50 in the US. I think they may have added 1 or 2 more, but there's still a lot of states you can't do this. So if you're like thinking about doing this in your home state or going back somewhere else, you want to look it up and make sure that you can practice as a naturopath there, naturopathic doctor, and you can do the things you want to do. Arizona, by coincidence, is probably the best state in the whole country to practice naturopathic medicine or naturopathy, because you can do pretty much whatever you want. Like you can, you can adjust like a chiropractor, you can prescribe drugs like a medical doctor, and you can prescribe, all the botanicals and the herbs and all that, and you can do nutrition, and it's a pretty sweet deal. Like you got a pretty cush. Chiropractic, so similar program in length, 3.5 to 4 years, usually 10 semesters back to back, or and that's like 3 semesters a year because summer's included, it's like trimesters, or 14 quarters. Okay, the DC degree. Education also very similar to medical school. You get the biology, chemistry, biochemistry, anatomy, physiology, pathology. You don't get the drugs and you don't get the surgery. You may learn a little bit about pharmacology, but that's not your focus, because your focus is on treating things naturally. So, but you get a lot of time learning what some people call physical medicine. I hate that term, but it's chiropractic, learning adjusting, learning how to work with the nervous system and the musculoskeletal system by putting your hands on people. Okay, so great. You can practice pretty much anywhere in the world. All 50 states, chiropractic's legal. You can practice as a doctor. I think the one country is Indonesia where it's illegal, but otherwise, knock yourself out. Okay, cannot prescribe drugs or perform surgery, and this is my profession. I have no desire to prescribe any drugs or perform any surgery. Okay. This gives me a really wide skill set, so I can do the nutrition stuff, which you learn in chiropractic school. You learn nutrition in chiropractic and naturopathic school. You don't really learn it in medical school. So I can do that, and I also have a skill set for treating a lot of the pain stuff that is going on, the chronic pain stuff, because we don't want those people on opioids, right? Like we want to have natural ways to do it that aren't addictive, don't have side effects. Okay. Physical therapy. Doctor of physical therapy is another great profession, right? Usually about 3 years. Again, similar to medical school, don't learn drugs, don't learn surgery, but learn a heck of a lot of physical therapy. So this is great for treating all kinds of musculoskeletal conditions. You become a whiz at the human body and anatomy and biomechanics and all that stuff. Can practice in all states in the U.S., but most of the states it's with a limited scope. So a lot of states, if you're a doctor of physical therapy, you can't take on new patients on your own. They have to be referred to you by a medical doctor. Okay. But in Arizona, that's not the case. In Arizona, again, you have opportunity for a great scope of practice. You can see patients they can come directly to you if they find you. There's a lot of physical therapists who have great practices here where they're essentially they can see patients directly. So it makes it really easy to be a physical therapist in Arizona as opposed to a lot of other states. Acupuncture. So there's mainly like 2 ways to do this. There's a master's degree, a master's of acupuncture in what's called Oriental medicine. I think they want to call it traditional Chinese medicine now. And then there's a doctorate. And so most people are still getting the master's. The doctorate is fairly new. And so it's going to vary by program, but typically you're learning acupuncture along with herbs and herbal nutrition and some nutrition type stuff. Now you can practice in all states, but 3 of them, and the 3 of them that you can't, it's the stuff, places aren't very desirable, like South Dakota. Nothing against that state, but probably not a place where a lot of people are like, oh man, I can't practice in South Dakota or Alabama, like. Like you can practice pretty much anywhere where the doctor is recognized, and you can call yourself a doctor and function as a doctor with a doctorate degree. That's relatively new, only in the past 5 years maybe, and I don't really know that. But you can, with a master's degree, you can be a licensed acupuncturist and do a lot of great stuff. So there's kind of multiple options there for you. So body work and energy work, and this is a pretty broad thing. And this incorporates massage, neuromuscular therapy, polarity therapy, like so many different techniques. And so these are typically not a degree program, and it varies by where you learn it. So for example, Southwest Institute of Healing Arts in Tempe teaches a lot of these things. And so you can help a lot of people with this stuff, okay? Because it's going to help with pain, chronic pain, depression, anxiety. The energy work can work with anxiety, past trauma, trapped emotions, like things like emotional freedom technique, which is like acupressure tapping. It's very powerful for that. You can't diagnose, prescribe anything. You can't advise on diet. You can't sell supplements or anything like that. But you have some very powerful tools in your tool belt. And so another option is to do one of the degree programs and just learn some of this as well, and have another tool in your toolbox. I personally, as a chiropractor, do a lot of energy work, especially when it comes to like people who have back pain, but they also have like past trauma from their childhood that's kind of making it worse. We can work through some of that and get them a lot better results than if we just treated the body, if we worked on the emotional body as well. So this is kind of broad. It's really hard. There's so many of them out there. I'm not familiar with all of them. You can be like a kid in the candy store, like learning new techniques with this stuff forever. But I would say, like, at least look into it. Hypnotherapy. This is one of my favorites. I am not a hypnotherapist, but I'm a big fan. Just to give you an idea, when I was first going through all these health problems, I was hardcore addicted to energy drinks. Like I was knocking back like 2-3 monsters a day. So boom, 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 boom. And I couldn't quit. I couldn't stop. I knew they were bad for me. And I tried everything in the world to quit. So finally I thought, okay, I'll try hypnotherapy. It's worth a shot, And I'll tell you, after the first session, and this was coming up on 9 years ago, I never ever had another energy drink or like a Mountain Dew or soda or anything like that in my life since. And I haven't wanted one. I haven't desired one. I did do a second session like a week after the first one, but that was just sort of to lock it in. I have had no cravings ever since. This is a very powerful tool for transformational change, because like we talked about, a lot of these diseases that are killing people are diet and lifestyle based, okay? And is it easy to change your diet? Do people just go, oh, bacon cheeseburgers were causing my heart attacks. Well, I'll just go completely 100% organic, raw vegan, and only eat fruits and vegetables now for the rest of my life, and it'll be easy to implement. Like, no, of course not. It's hard, okay? It's hard to get people to change. Smoking kills so many people. It's so hard to quit. But boom, one hypnotherapy session sometimes, maybe 2 or 3, people kick the butt and never smoke again. Like, I mean, that is amazing. Like, they're saved from heart attacks, they're saved from lung cancer, like their health improves dramatically. And not only that, I mean, you think about the money you save. People like, what does a pack of cigarette cost these days? Like $7-8 bucks. People are smoking 1 or 2 of them a day. Okay, like $100 to do a hypnotherapy session. It pays for itself in like a week. And so not only are you saving people their health, you're saving them a lot of money because they're doing a lot of other treatments, or they're getting really sick and having to pay for that. There are multiple ways to serve people. So. And this is something that I always thought about, I should learn hypnotherapy, like if I can ever set aside the time to learn it. So 100 hours-ish of study, and if you want to do a degree in it, it's like 1,000 hours of study, but you can learn a lot in just a short course. Help people with stress and trauma, a lot of things that like prescription psychotropic medications, like the Prozacs and the Zoloft, really have a hard time treating. You can do with hypnotherapy a lot better, in my opinion. So that is pretty much it, guys. That's kind of the rundown on all of them. I hope that I explained, kind of the need for it. Like, not only said like, oh, we kind of need, like, we desperately need it so bad. We need people going into these fields. And so I'm really passionate about mentoring people who want to do this. I was really excited to do this talk. So the emails in the chat box, hit me up anytime. If you have questions, you need mentoring, like, I'm happy to chat, and then we can open up to questions now. So Stephanie, you can start unmuting people, and I'll stick around as long as we need till Q&A. We set aside like an hour and a half for this talk, so just fire away. Happy to answer any questions y'all have.
Okay, I just clicked unmute, and I think people are trying to unmute themselves. Love how that works. I have a question for you.
Okay, yeah.
So why did you study chiropractic instead of just going directly into nutrition, since food was your medicine?
Yeah, good question. completely forgot to include this in the talk, which is stupid. But the nutrition field, especially for like a dietitian or a nutrition health coach, is highly unregulated. And that people can essentially just slap the word coach on their name. There are certifications out there, but you don't really need one. And so it's kind of like the Wild West. Okay, and so like people sometimes invest like thousands of dollars in these programs to become a coach and don't really see much out of it, because mostly the people that are successful as health coaches are really good at the sales and marketing aspect. You don't even need to be that good as an actual coach. I think that, you know, there's nothing wrong with doing that or getting a registered dietitian thing. What I really wanted to help people with was autoimmunity. And so a lot of people don't understand that that's diet-based. And so if I say I'm a doctor and I help people with autoimmune disease, that makes more sense to them than saying like I'm a nutritionist and I help people with autoimmune disease. Because they're like, what are you talking about? You treat autoimmune disease with drugs. So it's a great question, by the way. I'm sorry, I didn't mean to like belittle it. It's a fantastic question. I think that I see a lot of people go down the road of getting these nutrition certificates and really struggle and not have a lot to show for it, unfortunately. And it's mainly because nutrition is highly unregulated. Like you have people, you know, if you have the dietitian program, the funding money for it comes from sponsors like McDonald's, Coca-Cola. So the stuff that they're teaching is basically like, you're trying to eat a little less junk food, not drink so much, you know, Mountain Dew. Like, you know, maybe some good, but it's what you're learning a lot of times is like I don't know. I'm not.
I get your point. Yeah, they're still teaching people in the registered dietitian program to advise people to drink milk for calcium, and yeah, totally get that. I won't. I am a nutrition major, actually, and I will not be a registered dietitian. I want to be a nutritionist. I want to get a master's degree in nutrition, and I want to focus my effort on plant-based nutrition, teach people all about plants and the power of food as medicine. So that's my ultimate goal. Okay. And I want the credentials to support that are like legitimate evidence-based nutrition. Here's your support for plants.
Yeah, it's unfortunate that there's a lot of people who are uncredentialed out there who are telling people, you know, like carnivore diet and all this stuff, and it sounds flashy, and you know, it's the hot thing right now. Like if you're around in this field long enough, there are sort of trends that come and go, and people hop on these trends and give a lot of bad advice, but they can get an Instagram picture where they got abs, and so suddenly people want to listen. Unfortunately, is how it kind of works in the nutrition world.
Okay. You mentioned the health model.
Yeah.
Can you go into a little bit more detail about what that entails?
Sure. And I probably didn't explain it as well as I could have, but it's basically a big paradigm shift. So I have to explain it in context of like how it's different from the medical model and the alternative medical model. Which basically say that the substances, forces, influences, conditions that make you stay well when you're already well are different than the substances, forces, influences, conditions that get you well once you're sick.
Okay.
And so the health model says that they're the same, that the things you do to get well when you're sick are the same things you do to stay well when you're already well.
Got it.
But basically, like the medical model is like a quid pro quo. Like if you have diabetes, you take metformin. Okay. If you have heart disease, you take lisinopril. All right. But the health model says heart disease and diabetes are both caused by poor lifestyle choices. We just eat a plant-based diet, we can reverse both of them. We don't need a separate drug for either one. These are just results of unhealthy living. And if we start living healthy, that disease essentially is no longer even an issue. Does that explain it?
Yeah, absolutely. I think a good example would be that I use probiotics and mostly fermented foods. I won't usually buy like a probiotic pill because I've learned recently that probiotic pills are one strain of bacteria or a few strains of bacteria, and you need a variety of bacteria in your gut flora to be a healthy, gut microbiome. So I've been, anytime I feel a little bit under the weather, I'll add more of the immune supporting probiotics into my diet. I'll, get some kefir, or I'll get some different yogurts, and I'm really excited that the plant-based yogurts have bacteria in them, so I can still get the bacteria from those.
Sure. And so the probiotics in a pill are just a classic example of the alternative medical model. They say, oh wow, these probiotics are all the rage right now. Let's create a product in pill form, and it'll say probiotic, and it's a hot trend, and people are too lazy to like make kimchi or some kind of thing. We'll just sell it in pill form, and like we can make some money, and people go, oh, there's probiotics in this thing, like, it must be good. But it's funny is that there's been independent testing where they check a lot of these probiotic samples, and they found that the bacteria inside them are dead. So
yeah, that's another good argument, that you should really have living food to get your probiotics. Definitely. Anybody else have any questions for Dr. Ben? I see you talking, LaTanya. You're on mute.
Yeah, everybody's on mute. I think there's a raise hand function, or just type in the chat too. You can type in the chat.
Yeah, I was saying that I didn't have any questions. I understood what he was saying, and I screenshot the format for going to school, the school course, the career, thing. So yeah, because I did have a question about that, but it was in your presentation. So yeah. Oh, I do have a question. After graduation, and you go to, you start to learn more about, you said, the things that they don't teach you about in medical school. Was it hard for you to start your practice? Is it harder for NDs versus DOs or MDs to start their practices?
I think it's difficult for everybody. Like I don't know anybody who's had it easy. It helps. Maybe you need to like get a job with someone else who's successful in practice for a little while before you strike out on your own. I was always kind of too bullheaded to get a job working for anybody else. Like I had to do it on my own because I had my own philosophy about how things needed to be, which didn't agree with a lot of people out there. But no, it's not easy, and that's why I was saying you got to be passionate. You got to love it, because if not, like, if you're just in it for the money, or you're just in it because like I think that's cool, like it looks cool, like, you're not gonna last. You might not even make it through school. School's hard too.
Yeah.
I have a couple questions. Are there any sort of international or national conferences and or journals that you can join if you want to learn more about alternative medicine as the field in general?
There's a lot. There's so many. And I don't, I know a lot of the chiropractic ones.
Okay.
There's one, let's see, that I really like. There's a nutrition one called the International Journal. I think it's a disease prevention and reversal. That's a really good one.
Do you mind just putting it into the window just so I can copy it onto my notes?
Yeah, I typed
That
it
one
in.
you just did?
Yeah.
Oh, thanks.
Let's
Thank you.
see. There's something called JMPT, which is a chiropractic and physical therapy one. It's like Journal of Manual and Physiotherapy. And then let's see. Yeah, like this is if like you want to get into the scientific articles. This kind of stuff is good. If you don't have a background in it, some of this stuff can be like pretty technical and tough to like figure out what the heck they're talking about.
Okay.
And so for like, I know, let's see, another chiropractic one is like, what is it, like the Journal of Vertebral Subluxation. Yeah, and then, I mean, there's countless medical journals, and, people in the alternative field do get published in things like, Nature and Science and Sport and Spine, things like that. But typically, if it's not a drug or surgical intervention, it's a hard time getting published in a mainstream medical journal because most of their advertising dollars are coming from drug companies and surgical device companies that don't want to see that kind of thing.
Okay.
Yeah.
Thank you.
Sure.
What about any sort of conferences, like a meeting of the mind? So, for example, if you're
Okay.
wanting to collaborate with others who are interested both in your specialty and also in other alternative medicine so that you can build a community within Arizona, for example, do you have like any conferences, or do you have any meetups that you attend? Anything that you would recommend for people who want to do? So I already have my master's. I'm thinking about getting my PhD. I'm just not sure what in yet. So I'm just wanting to elevate my practice, but kind of find out what others are doing and then how I can collaborate with them.
Sure. And I know the ones from my profession, like there's the ICA, International Chiropractic Association. We have a Arizona Chiropractors organization, but I'm not it's not super active, and I'm not really a fan of what they do. There is a conference which I have not attended in a while on plant-based nutrition, and it's held in California every year, and I think it might be just called the International Conference on Plant-Based Nutrition. That one's a good one. But what field are you thinking about getting a PhD or thinking of studying?
So this is going to be very different. I'm kind of good trailblazer, but I'm actually in healthcare, but I do patient experience and service design. So I design different services, so patients' journeys from different acute or medical practices. So I'm thinking about getting out of the traditional medicine model and into more of an alternative medicine, but I would be doing more of the business, so the collaboration, bringing in different practitioners, and then be honing their medical specialties. So I'm not sure where I want to go with it. I'm not sure if I want to do environmental psychology. I'm not sure if I want to do service design. I'm not really certain at this point. So
Okay.
I'm just trying to branch into it and understand the current landscape, and then where there might be opportunities. And I think I'm going to have to start my own practice, but because I'm a little different. So, but I just am interested to see what currently is going on, and then where I can start the foundation process and kind of build from there.
Okay, yeah, I'm that sounds super new to me, and I'm like racking
It's very different.
think of stuff, and yeah, like you're really trailblazing. So I wish I had a better answer for you.
That's okay.
Yeah, so if you were to do the patient experience thing, like what does that constitute? Like, explain it to me a little more, because it's like somewhat foreign to me.
Sure. So let's say that you go into the hospital and they prescribe a medication to you, and you're very sick the entire time, and you don't really remember, okay, well, I don't remember what they gave me, and I don't know why I have to take this. And then you get home and you're like, I'm completely clueless. I kind of remember them talking about this, but not really. So the whole idea would be, I would work with clinicians and patients so that next time you came in to talk about your medications, that over the course of your stay, I would be helping to design to say, okay, here's the name of the medication, why you're taking it, and here are some common side effects. And so by the time you leave the hospital, you'd be able to go home and feel more confident in your wellness, because you could say, oh, I know what I'm taking and why I'm taking it. and what this is going to do to me and things like that. So that's just an example of one of the pieces of patient experience.
You'd be like
But I'm
consulting with like hospitals and healthcare providers to teach them how to provide a better patient experience,
yes,
or you'd be like an advocate for patients while they're in care.
it's both. So it's actually it's under quality improvement. So there are a set of like 30 different questions depending on what setting you're in. And it goes through and asks about, like privacy and the noise, medication communication, your communication with providers, with nurses, etc., what your perception of teamwork is. And so basically you create service offerings based off of these set of experiences that's mandated by CMS.
What's CMS?
The Center of Medicaid Services.
Oh, okay.
Yeah. So it's basically something that's set in stone. That's already something that's a best practice type of deal. And you're collaborating with others to enhance the way that your patients and your family members experience a certain service offering. Or someone goes in and has a pregnancy and had a bad experience. Then you're working with patients to say, well, how could we improve it so that it's better next time, both from a clinical perspective and also an experience perspective.
Gotcha.
So it's very different than alternative medicine, but it's an avenue that can be applied. I just have to figure out how.
Sure. And so I'll give you my thoughts on this because it kind of brings up, it's interesting to me. And so I want to give you guidance, and like, I don't want you, trying to do something that won't work out. Not that I want to discourage you, but just give you lay of the landscape. In the hospital setting, and for patients who have Medicare or Medicaid or these very like bare bones insurances, they're going to these places and getting this care because it's basically the only option that they have. And these places kind of can get away with being very poor quality and having poor patient experiences because like person's not paying anything out of pocket and it's like kind of their only option. And so they just kind of do the minimum to get by as far as healthcare providers for these people. And they're not really motivated to give them any sort of good patient experience because it's a lot of drudgery, especially with an insurance-based system, or it's just sort of like, well, patient came in and they have this condition, like they know exactly what they need to do for this person, and they know exactly how much they're going to bill their insurance and exactly how much money that they're going to make. And so it becomes like a numbers game, just sort of churning as many people through as you can. And there's not a lot of like incentive to like take really good care of people, unfortunately. And so you put in these quality control things, people are complaining, but a lot of times like people don't really have a lot of choice in why they're there, unfortunately. In most alternative fields, like if you're not providing good customer service, like people aren't going to come back because it's not like most of these things are not billed under insurance. Like insurance doesn't pay for these, doesn't pay for things that get you well. They just pay for things to manage your disease. So if people are paying out of pocket, like they have choices of where they can go, and if they have a bad experience, like there's out. So a lot, I have to be, this is something I have to do in my practice because there's another chiropractor like a block away that they can go to. Now, I mean, obviously I have many ways of differentiating myself, and unique service offerings and things like that, but there's competition, and since people are mostly paying out of pocket, like they have options, and if they have a bad customer service experience, they can write a negative review on Google and they can write a negative review on Yelp, and it's very different. There's nobody really getting away with doing the minimum in these fields. So, I mean, like I can see where it's needed. I think that like even the fact that needs to exist in a hospital is just sort of a symptom of like how broken it is.
Yes.
So like, you learn a skill set that's valuable, and there's going to be a way that you can apply it. I'm sure you have, a lot of things you can offer, and obviously the healthcare system, needs a massive overhaul. But if it's like, we're doing a better job of cutting off Susie's toes when she has diabetes, like it's kind of just like still in this old paradigm of like, well, why does she even have diabetes in the first place? So I don't know if that answered your question, but I think that like what the scenarios you're describing just don't happen in my office or anybody that I know, because it's just a totally different paradigm.
Okay, thank you.
All right, so I'll put my email in the thing there again. And yeah, seriously, if you have other questions, like you think of them later, or you didn't want to ask in front of everybody else, or like whatever, or you're like, I just don't even know, like sit down and brainstorm with me and help me figure this out. Like totally happy. I want people to you know, be successful and you know, have guidance in this, because it's kind of the Wild West out there. And you know, and you know, I can introduce you to other people who are successful in the field that you want to be successful in, and that can really help you. So thanks, guys.
Awesome. Thank you, Dr. Ben. That was awesome.
Thank you.
You're welcome. Let's stop recording.